Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam, a cardiologist, Houston, Texas. In this presentation, we're going to look at AI-assisted 2D echocardiogram learning, interpretation, and analysis. This is good for whoever wants to get more information and diversified findings and inferences so that you can look at it from a different perspective than what you're thinking about yourself. So it may be useful for students, techs, fellows. Of course, you have to take this with a grain of salt because AI has had its recognition for doing things which are exceedingly good, and sometimes AI can be totally misleading. Anyway, so let us focus upon we are going to present this image of an aortic valve, a continuous wave Doppler with a Vmax of 6.78, V mean of 5.25, and a mean gradient of 118.9 millimeters of mercury, and a VTI of 204 centimeters, heart rate of 36, a pretty slow heart rate. So we're going to put this into ChatGPT, but I use Perplexity. So let's get to Perplexity and see what an AI search engine can do in terms of recognizing the abnormalities and in terms of interpreting this particular image, which may be useful in learning because we get a different perspective and we get a lot more parameters than what this image itself shows. So let me get you to the real. Okay, this is. I'm using Perplexity because it has a web search, so it has the latest link. As you can see, it is taking references from ESC Cardio, ASC Echo, ASC Echo, Diagnostic. So it has all the new on references. So it's not like it is just throwing darts. Okay, let's start up. First of all, we have to understand in order for AI to be useful to us, we need to be smart in terms of asking questions. So I said, explain all the normal and abnormal structural findings in this image, which is the image I just showed you. Explain the various parameters from the Doppler images. What does this image show? Summarize. Discuss the latest guidelines for determining the severity of aortic stenosis. What other tests can confirm the diagnosis and support a decision making? So these are the questions we have to ask. So the key or the crux is in asking the right type of questions when it comes to AI, so we can streamline everything that is appropriate. And here's how the AI interpreted it. It says structural findings in the echocardiogram image, normal cardiac chambers, grayscale 2D image at the top suggests the study is in a standard parasternal long axis, which is not the view because it is a 4-chamber view. Anyway, let's keep this in mind because this is one of the negative points, and we're going to come back to that. And then it says left ventricular outflow tract, aortic valve, proximal aorta. That's all correct. And it has a cursor at the aortic valve level, continuous wave Doppler. The abnormal findings, it shows continuous wave Doppler trace. Below shows markedly elevated flow velocity across the aortic valve. Severe flow obstruction. The shape of the Doppler envelope. It says dagger-shaped appearance, but it looks more sort of uniform to me. It is not the dagger-shaped appearance you see in patients with subaortic stenosis or hypertrophic cardiomyopathy. Anyway, so the velocity, it read it correctly. The mean velocity, the max gradient, mean gradient, and interpret this as severe aortic stenosis because the gradient is greater than 40 millimeters of mercury, and the VTI of 204, which is significantly grossly abnormal. Okay, it's abnormal. So the summary is, it says severe aortic stenosis based on significantly elevated peak mean velocities and dagger shaped, which I don't agree with. Anyway, let's keep that in mind. And that's why I said we need to pick the good ones and we need to ask the right questions. Those are some important key factors. Now, coming into the latest guidelines, according to the ASC, if the peak velocity is greater than 4 meters, mean gain greater than 40, and you know the usual stuff. And the key points is, severe aortic stenosis with a Vmax of greater than 4 meters per second, greater than 40 millimeters of mercury, the aortic valve area being less than 1 centimeter per meter square. So we have all those things. And then I asked, what are the other tests that we can do that can give additional information and all these things? This is like more than a textbook, because a textbook has an opinion written by one author, whereas here you get the opinion of the entire medical literature with the latest articles being referenced. Okay. Transesophageal provides detailed visualization of thoracic image quality and is up if the image quality is suboptimal. Cardiac CT can look at valve calcification and especially the gradients. Cardiac MRI, which is supposed to be a gold standard, is used to look at the anatomy of the aortic valve, but also you can look at the anatomy of the aorta, and if it is feasible for a given particular procedure like TAVR or surgery. And exercise stress may be helpful in case of questionable gradients and in patients with low ejection fraction, but that's not the case here. So cardiac catheterization, of course, is useful, not necessarily for detecting presence of critical aortic stenosis, but for looking for other abnormalities such as coronary artery disease, etc. Examination. And again, it summarizes all the findings seen in this particular one. Then I said, this appears to be a 5-chamber view, and it did not properly answer, and I asked for it to interpret on the chamber size and all these things. Unless there are some numbers, it may not be able. It didn't interpret the numbers, but it did give us the latest guidelines as what is normal and what is abnormal. Left ventricular end diastolic diameter. The normal range is 4.2 to 5.8. In women, 5.2 is the max. So here you get all these different parameters, which are very useful, because now you don't have to look at a book, you don't have to look at something else, because these are all from the ASC reference articles. And as you can see, even it gives the right ventricular size at the basal, mid, length, LVOT diameter, all these things. And then it interpretation of severe aortic stenosis, LV, LA, RA, RV, OT, all these things. Next thing I asked was, tell me about the dimensions of the chambers in the image. It could not really give me an appropriate answer because it couldn't find any numbers. If there were some measurements, it would have probably said it, but it just gave me the normal ranges, which is nice to know because these are important things to keep in mind. Conclusion. Then I said, can you interpret a video image or a video loop? And it says, yes, I can interpret echocardiographic video images provided you upload the video or share a working link. That's pretty good. Then it can, a short video or a GIF is fine, or give a link to that particular video clip. Then it can identify echocardiographic views, assess chamber sizes and wall motions, look at valve morphology, stenosis, calcification, fibrosis, restriction of movements, pericardial and vascular structures. So it can, in fact, assess a video loop. So if you are a student or a tech or someone who is learning the study, you can take the video loop and feed into the search engine, which is AI search engine. In my case, it is Perplexity. Then see what it says, because it may say a lot more things we didn't know. Some of the things may not be accurate, so you just disregard the things that are not accurate, but look at the things that are relevant. The other point I want to bring out is that, these are not just from just imagination. Here is a PDF of a ASI website, which gives you the reference to all the left ventricular measurements, volumes, and sizes for all various structures. So not only do you have access to general interpretation, differential diagnosis, supporting documentation, but also references to articles which may be very difficult for you to find. In fact, I'm going to download this article. I'm going to save it under my echocardiography. Anyway, this is under my cardiology section. I'm going to save this PDF. This is very useful for me. So as you can see, you can build your knowledge exponentially than just looking at an image or just getting one opinion, because look at all these different things that are covered. So you can tangentially go and explore more by just posting an image or a video clip and then asking a series of questions that will give you the answer, and also references. So always remember, these references are real. This is from the American Society of Echocardiography. So you cannot, undermine the reference here. So ladies and gentlemen, this is a quick analysis of how AI can help us learn echocardiography in a much more meaningful manner, and also learn all the variations, all the exceptions, and you can go back to the original reference articles to improve your knowledge and wisdom. Thank you so much for watching this presentation. Please do like this. We have hundreds of videos on echocardiography and heart disease. You can watch them, and I will see you in the next presentation.